Hi everyone. So in this video I want to talk about antidepressants and maybe more generally psych meds and weight gain. So in my case I've definitely experienced weight gain on antidepressants. Specifically for over a year now I've been on Cymbalta or duloxetine combined with olanzapine. And the first one is, I believe, an SNRI. The second one is usually used for, I think, for bipolar disorder. But in my case, the doctor I don't have bipolar disorder. I just have depression. But I think for some reason he thought it's a good combination. And my understanding is it helps with sleep. Now, regarding weight gain, I've definitely gained quite a bit of weight on these two meds for having had them for a year. I think I gained around 18 pounds or 8 kilograms within year's time, and you can see a difference in my face if you look at the older videos versus now. However, I've actually lost some weight. It was actually more dramatic of a weight gain than can be seen from the videos. By comparing videos, I've actually lost some weight since then. Now, the reason, my understanding, having tried to look into this, the reason that people often gain weight on antidepressants and maybe psych meds more generally is that it can be through two different mechanisms. One is that your appetite increases, so obviously then you'll be more inclined to want to eat. And secondly, you tend to burn less fat. You're less likely to burn fat. So with these two things in practice, it makes it you're more likely to, of course, then consume more calories, and then you're less likely to lose the calories that you're gaining. So what can you do about it? Now, in general, there's at least a couple of ways one can go about it. There's sort of the obvious, exercise and diet option that applies to anything related to losing weight. However, it can really, especially I tried to look into this, and I think a lot of people, they will actually still try to exercise and restrict their diet without having much progress because, as I said, the drugs make it really hard because even if you do restrict your diet, you might still not burn the fat as well as you would without being on the meds. The other option is is meds, is just varying the med, basically changing certain meds. Some antidepressants might be less of a problem than others. A common one that people take if they want to have less of the weight gain side effect is Wellbutrin. So with Wellbutrin, some people even lose weight, and often Wellbutrin is used as a combination drug with other antidepressants. So that might be one way to do it, or some other variation, just trying out different antidepressants, for example. Now, in my case, what I'm trying to do, at least right now, and have been trying now for at least a couple of months, is mainly a diet restriction, just cutting a lot of just eating less in general, be it for breakfast, lunch, or dinner, and trying not to have any late night meals, anything like that. And that has been successful up to a point, although I'm at a weight, 80 kilograms, I'm not sure how much that is in pounds, which is, at least right now, I'm within normal BMI for my height, but I seem to be unable to lose any more weight. I'm almost at the point where I would consider wanting to have some change to my meds to solve this problem, because just to maintain my weight, I'm finding that it's difficult. And if I go up any higher, I'll be in the overweight range, which I was in for most of the past year due to the meds. One idea I've come across is some people say that specifically low carbs, possibly no carbs if you can pull it off, can be really effective with losing weight on antidepressants. I've tried to at least cut the carbs, and I guess that's at least helpful up to a point. And that's it. So if you are gaining weight while on antidepressants or psych meds, I think that's quite common and totally normal. And your options are what you might expect with regards to exercise, calorie restriction diet, and possibly, however, there's also the option of changing your meds. And best of luck to you all, and hope that you found this helpful in some way.